So what happens if I have knee pain and I think that I have arthritis? When you see the doctor, they will do a very comprehensive assessment for you. The first thing they do is ask you a lot of questions about the history of the pain, as well as to ask you whether you are having knee stiffness, swelling, or deformity. Doctor will also want to find out more about your work requirements because he needs to know how the pain and the swelling is affecting you at work. And a functional assessment will also be done because they need to find out more about what you do in your sports and for your recreation, so that the doctor can come up with a holistic treatment plan that is best suited for you. After he's taken the history, the doctor will also examine the knee. They will assess for knee deformity, like we saw in the previous slide, whether you have bow-leggedness or knee deformities. It's also important to check where the area of pain and tenderness is. And the doctor will also check whether you have any knee stiffness by assessing whether you can fully straighten the knee and fully bend the knee. Lastly, the doctor will check whether or not you have any ligament injuries, and they want to make sure that your knee is stable. After examining you, normally X-rays will be done to see how bad the arthritis is. Sometimes an MRI scan may also be done if the doctor thinks that he needs further investigation. So what are the treatment options for arthritis of the knee? We normally divide them into surgical treatment and non-surgical treatment. For mild cases of arthritis, non-surgical treatment is usually successful. The most important component of this is physiotherapy. We like to send patients for at least 3 to 6 months of physiotherapy to strengthen the knee muscles. And when the knee muscles are stronger, the knee joint becomes more stable. Patients feel less pain and they can walk further and even climb stairs. Other things that need to be done include diet and weight loss, activity modification to avoid excessive squatting and stair climbing and heavy loads. A lot of patients also find that wearing a knee brace is very useful, especially if they're going to work or they're doing exercise. When you're not doing work or exercise, then you can take off the knee brace and don't wear it the whole day. Some doctors will also give painkillers to help patients manage their symptoms. And some patients find that glucosamine may be helpful in reducing that pain. When the arthritis becomes a bit more severe, in moderate cases of arthritis, sometimes the pain is a bit persistent despite physiotherapy and medication. So we can consider injections into the knee for these patients. In the old days, steroid injections used to be the most popular. And steroid injections have pain relief that lasts for about 3 months. But the problem with steroids is that they have quite a lot of side effects. So nowadays, there's a move towards giving more lubricant injections or gel injections into the knee. These gel injections can last about 6 to 12 months if they're successful, and there are very few side effects.
Setelah menonton video ini, jangan lupa subscribe channel Tekon TV. Share video ini jika kamu mendapatkan manfaat darinya. Terima kasih.